So I've titled this presentation, Estimating Population Access to Built Environment Features Across Global Cities, Data, Methods and Some Findings. That was probably ambitious that I would be able to present all of this. What I'll focus on kind of some of the key challenges related to data and discuss some of the data sets we've used to solve these and some of their limitations. And we'll go from there and we'll see how much time we have. So the Global Healthy Liveable Cities project is an extension of a long-running program of work undertaken by researchers within the Healthy Liveable Cities group and the International Physical Activity and Environment Network, IPEN. So a lot of these projects have been concerned with the health and wellbeing impacts of access to the social determinants of health, and in particular with the use of urban design and policy to encourage physical activity. So this project was initiated by Billy Giles Cortai in conjunction with Melanie Lowe and Jonathan Arundel and other colleagues from the IPEN network. And it involves a large number of collaborators supporting a core research team, which is based all around the world also. It builds on the 2016 Lancet series on urban design, transport and health, in which 8 interventions to promote health were proposed. I'll just display a slightly related, but not directly related to that statement, path diagram, which is an excerpt from that article. So the rationale for this project was to, as in the Global Healthy Liveable Cities project, was to undertake policy and spatial analysis surveys to determine the degree to which these interventions are being supported by policy in cities in diverse contexts globally, and the degree to which these are being achieved, measured in terms of both the within city distribution of indicators and between city comparisons. For context, this project really does evolve from a series of studies undertaken by the IPEN network. The 2009 eponymous study, the network was established in 2004, I meant to say, but the eponymous study IPEN Adult, taken some just key quotes here for each of these points across time. It pooled data from at least 14 countries to estimate strengths of association between detailed measures of the built environment and physical activity in adults. In the 2012 IPEN adolescent study, the goal was to implement comparable methods and measures across diverse countries, so data could be pooled across countries for analyses. And the main findings were presented in a Lancet paper in 2016. And this little snippet here is that adults from 10 countries who lived in the most activity-friendly neighbourhoods did up to 90 minutes more physical activity than those who lived in the least activity-friendly neighbourhoods. And that amounts to about 60% of the recommended 150 minutes per week of physical activity. So that kind of establishes the relevance of this kind of local neighbourhood livability analysis. My involvement with this program of work actually did start with the IPEN adolescent study. I did the geocoding and built environment measures for the Victorian arm of that study. In 2016, I was involved in work with our colleagues in this group, Hannah and Billy and others, sourcing data for a national livability project, and I developed methods for creating an address level livability index. And this was designed to be a generalizable framework, which we then applied for calculating capital city livability indicators, which fed into the analyses presented in the Creating Livable Cities report. And then we expanded to a number of regional cities around Australia as well with our National Livability Program. And these indicators are in the Urban Observatory. And then we started branching out with other partnership projects, the Bangkok project with Amanda Alderson and Hannah Badland and Melanie Davin, and the Global Indicators project, which I'm presenting on today. And 2020 was a big year. Part of that was I started a PhD as well. And if we get to have a bit of time, I can say how that relates and feeds on from this work. So these are the cities around the world involved in the Global Healthy Livable Cities project. You can see that there's a diverse range of contexts and it's not evenly distributed. There's clearly a lot of cities in Europe, only one city in Africa. And so these locations reflect the locations of members in the IPEN network. And so there's that historical continuity of the cities that have been involved in the IPEN studies. And that's why that is, but it's still, I think, an interesting collection of 25 cities across 6 continents, or 7 if you count Zealandia, which is apparently a submerged continent. I learned that when I was starting this project. So the indicators we're looking at in the spatial component of the study are roughly summarized here. We're looking at aspects such as, and this is for the within city distribution as well as overall city summaries, the percentage of population with proximal access to a range of amenities, local walkable neighbourhood indicators, which are really the components of walkability and a walkability index. And we look at this both in terms of the spatial distribution across the study region, but also with regard to population weighting. So, which are two interesting sides to that story, different dimensions of equity, really. And then we work with model thresholds for meeting various population health scenarios that have been developed by, led in a program of work led by Esther Seren through the IPEN network studies to see the percentage of population who are meeting these various requirements for physical activity levels and to have impacts on health. So that's a summary of the kind of program of work. And in looking at that, I think you'll start to see maybe some of the challenges that we'll come across in terms of the data. How do we look at and make a fair comparison across these 25 cities for these data sources? If it was just local administrative data, people measure things in different ways. What is a public open space? What is a fresh food market? Is it point data? Is it polygon data? Is it a summary data set? Does the data have full coverage of our study regions? And what are these study regions? There's a lot of data challenges, and that's where I'll be focusing on today. Even more so than those data challenges and guiding the data challenges is the important aspect of context. And it underlies all of this, being sensitive to local context and the limitations of us as a centralized team of researchers, or relatively centralized, but distributed across 3 countries, but trying to represent cities across 18 countries. And we have limited knowledge. So that's where this network of collaborators is very valuable. I've got a bit off sequence there, but in terms of the data, 3 key issues here, which I think I kind of touched on there. Availability, is the data available? Is the data comparable between these cities? And what's the quality like in terms of spatial accuracy, temporal accuracy? Because obviously when you collect data, no matter the source, it's always a little bit variable in terms of when it was collected, when it represents, and how complete is it? And then there were challenges with methods related to this, which I probably won't have time to go into here. So we conducted a number of surveys of our local collaborator experts, reviewing the policy context for their cities and the situation of data availability. In having these discussions, it became apparent that that we would face issues having comparable data and available data for a number of cities. So the solution to make this project workable was to see, well, can we do this using open data? And in itself, that's an interesting research question. Can you do this using open data? And people do it using open data, so we felt like we could as well. But being sensitive to those limitations and having constant feedback with the local experts. So we did a preliminary analysis using data sets, which I'll introduce in the coming slides, and receive feedback. And this cycle of producing results and receiving feedback was an aspect that has continued and is continuing throughout the project, to make sure that what we're producing matches the expectations and understandings of people who really know the place, is in line with the data that they have and are aware of. So a preliminary aspect is, well, what is a city? What is an urban centre? This is really important because cities are very sprawling, and it's hard to say where a city begins and ends. Obviously, there are administrative boundaries, but are they? Does that relate to the actual understanding of the city? A good example is Mexico City. It's the city of Mexico City is kind of like Melbourne, the CBD, in a bigger sense, but it's a very sprawling area. The Greater Valley of that region is what we were guided by Deborah Salvo, our collaborator there, as to be the more appropriate area for where the urban population resides, and it's a much bigger expanse than would otherwise have been used. But in general, we found that the urban centres database in the Global Human Settlements layer, which is a very useful data set, or set of range of data sets that are developed by the European Commission, which had across a number of time points. I think it's something like 2000, 2005, 2010, and 2015. But in any case, we use the, it's actually, I got those years wrong, but you can see it on the slide. 1990, 1975, 2000, and 2015. We are using the latest epoch there. And there was a revision of these last year or the year before. And so it's the latest revision that we used here. So it's a modeled data set but using population data and satellite imagery to determine built-up areas, and they model what the apparent urban centres for a number of cities. It wasn't perfect. There was one historical city, Vic, that we were using in our study. It's a regional capital city in the province of Barcelona in Spain. A really long history, but a pretty low population of around 45,000, and it wasn't in the urban centres database. So that's one example where we had to account for using custom data provided by our collaborators for what is the urban area for this region. We also use the Global Human Settlements population layer, which is a gridded data set at 1 kilometre resolution approximately, with population estimates of, around the world targeting 2015. And obviously we're in 2020, so it's not up to date and it's a model, so it's not perfect, but in terms of it allowed us to treat our study regions consistently. We found that it was the best available data for our purposes for population estimates, to make sure that we weren't having issues such as inconsistent administrative areas that were quite large for some cities or quite small for others, and wouldn't provide for a readily comparable analysis. In terms of amenities and the network used to route around a city, we use OpenStreetMap data. Again, it's not perfect, but it has been increasingly used by researchers across the last decade, and there's a lot of it's very richly attributed data compiled through volunteer contributions, volunteer geographic information data set, loosely following community guidelines, and these guidelines do have some variation across time and across different countries and communities. And the degree, and certain individuals more or less adhere to those guidelines, but in the sense that there's a general standard that makes the data quite attractive when you're trying to do this kind of broad global analysis. Variation in quality within a city, but also between cities, and we were aware of this, and that's where the feedback from local experts is really important. And the potential to use custom data where required, such as Maiduguri in Nigeria, that we found that while the road network was adequate there, and there was adequate mapping of humanitarian facilities such as hospitals, which is the apparent priority for those who are using OpenStreetMap in that region, amenities such as supermarkets and public transport stops and the like, these weren't so readily represented. So we were able to get a custom data set for Maiduguri collated for fresh food markets and convenience locations and the like to supplement this data, which when we get a chance, it will be ideal to feed back into OpenStreetMap. In terms of public transport data, another really useful, not perfect, but useful data set is GTFS data, General Transit Feed Specification. And that's been around since around 2006. And from 2016 in particular, which is when it was made available being produced by Australian transport agencies, provides a standard format for public transport schedules, and you can use it for routing queries and determining access, kind of service frequency across a day and across space as well. It's often made publicly available by transport agencies, but not always, and not for all cities. And it's again, like OpenStreetMap and other data sets, even government data sources, the standards that are loosely adhered to, and which makes sense for a data set that's used across a broad range of public transport agencies. They have different contexts, and the specifications may not meet their needs. So in practice, there is some variation in how the standard is adhered to. So you have to take a bit of care with this data to make sure that the fields are have been, to make sure you're treating it in a comparable way, and you have to, as with any data, do data checks for it, including for completeness, because it's just because one public transport agency in the city has published a feed, it doesn't mean that's the full story of public transport in the city. And so this is through a survey of available data for our cities. This is an aspect we attempted to do our best to address. But yeah, a part of that story is custom data is really important. Even though we were trying to find consistent and single source data sets for all our study regions in order to have comparable analyses, if for some cities like Maiduguri or the other cities to do with their city boundaries or for other reasons, it just wasn't possible. So you need some flexibility to deal with those contextual aspects. In terms of methods, we have a forthcoming publication for the software framework which we developed, which is available on GitHub at this address here. So that's a repository for the project, and it also contains directions of how to set up a computational environment using a Docker image, which is provided as part of the software framework workflow. I won't go into detail on the methods, but we can, because it's broadly actually similar to other projects we've done in our group, like the National Livability Project, the Livability Index, and we've myself and others have presented on these before. Since I'm not sure how much time we have left, I'll quickly just share some findings, and then we can always have some questions. So there's a lot of data that we've calculated, and would be a lot to put on a screen. So I thought I'd put in just a few locally relevant snapshots in comparison. So on this slide, it's presenting the spatial distribution of walkability at 250-meter resolution using amenity data sets from 2019 and 20 and the population data that I mentioned before and boundaries relating to 2015. Modeled at a 250-meter resolution, and this is relative to the 25 global cities. So there's a theoretical average of 0. So the greener, bluer colours are trending towards well above at the global average, whereas the redder colours are well below the global average. So for Adelaide, Melbourne, and Sydney, it's not surprising. We know where our CBDs are, and they're in the suburbs. They have a lot of amenities. They have well-connected street networks, smaller block sizes. They're what fits this pattern of walkability as we measure it, which is a function of population density, intersection density, and land use mix. And we use for this study and other studies our group has done, we use a proxy for land use mix, which is called the daily living score, related to access to fresh food, convenience locations, and public transport. And it's meant to be indicative of, and previous other papers have looked at it, the degree to which it is indicative of as a proxy for land use mix. So it's also not surprising that a very dense city such as Hong Kong is that does better on all three of those measures than our cities in terms of coverage of the city. And what these images hint towards, but don't tell the full story of, is the population location. Obviously, the indicators within walkability are strongly related to where people live, and so you can get a sense that in Hong Kong, regardless of population density, in general, people have pretty high access to amenities, whereas in Adelaide, Melbourne, and Sydney, there's lower population density in a lot of these outer regions and outer areas where people are less well served by amenities. That is also reflected in the thresholds work. So here we're looking at maps of neighbourhoods meeting model population per square kilometre thresholds, which are modelled from the IPEN data, for meeting the World Health Organization target of a 15% relative reduction in insufficient physical activity through walking. So the threshold which was modelled for this was between, well, above approximately 5,000 persons per square kilometre for a local 1,000 metre local walkable neighbourhood. So the area you could walk within 1,000 metres within that buffered area, which is you could call a local walkable neighbourhood. You have a certain degree of population density. And you can see in Adelaide, well, actually those local walkable neighbourhoods don't meet that threshold, according to our analysis. In Melbourne, the inner areas and some pockets of activity centres, that is achieved. In Sydney, more so. In Hong Kong, much more so. And to put a number on those summaries, that's in this on this slide is the percentage population for meeting or being within or exceeding those thresholds for meeting that target. And it's an interesting story, but it's also one that needs to be contextualized because, of course, this is a model. Local neighbourhood population density is important to support provision of amenities, but it's not the full story. For example, if amenities are already accessible, as we know they are in Ghent, Olomouc, and Orns and Adelaide, all of these areas which here have 0% for that population threshold, have some areas with good amenity access, regardless of population. And Ghent, Olomouc, and Ons, by our measures, actually, in terms of percent of population with access to amenities, in many cases they would exceed Melbourne, Sydney, and Adelaide. So just because you have low population and you're not meeting this target according to our model, it's not to say that's the end of the story. It isn't. Ghent, Olomouc, and Ons actually do have pretty good access to amenities, notwithstanding their low population. But where population density and amenity access is relatively low, for example, many large portions of the cities of Adelaide and Melbourne and US cities, it is suggestive of car-dependent neighbourhoods and where opportunities for physical activity would be predicted to suffer. So that's where I think it's kind of interesting to look at these with both the within city estimates and the global comparisons, and thinking about it in terms of the spatial distribution and the population distribution, different dimensions of equity, to contextualize how these cities perform. And Melbourne was for a number of years known as the livable city, but for us who live here, we know it relates to some particular parts where people, maybe the expats might be likely to live. Not necessarily, certainly not the full story for the whole city. 17.8% of the population live in these dense areas, which would be expected to have better provision of amenities. And so that's the gist of the work that we've been doing. It's the policy analysis, spatial analysis, threshold analysis, and broader high-level papers related to the study are going to be planned to be published in Lancet Global Health series later this year or next year. And if you have any questions, I'd be happy to deal with those.
Thank you, Carl. I get out of the presentation.
Sure.
No.
Oh, I probably clicked the wrong one. I'm sorry.
It's all right.
I'll let you drive too.
Great. I'm not sure what's that view there.
I think it's that's Rebecca Roberts' car.
Oh yes.
Hey, Beck. It's a nice sunroof.
Okay. Well, thank you very much, Carl. That was very interesting. Now I can see someone's car on the screen, but we're going to address the questions. So, Carl, given that yours is closer to the screen, do you want to?
Yeah, read the questions.
Yeah.
Let me scroll up. Yeah, stairs and topography. So that's a really good point, Melanie. That is no, we did not, and it's a really good point. I guess the hills keep you fit, but we didn't account for them. Topography is tricky. I know we face this in our own work where we've wanted to account for topography in our walkability measures, and to some degree it is possible, but there's pros and cons, and depending on the data you use, there's that question about, well, is that hilly as it is, or is it modelling the hilliness of buildings, which is not necessarily accurate. There are considerations with the resolution of data, and anyway, it's a whole other ballgame accounting for the topography, and so you're quite right that is one of the number of limitations which of our study. So I would say our results probably, and the threshold result modelling results relate to adults, but not necessarily older adults or younger ones, or those with different ability considerations. I hope that answers your question, but it's a really good point, and there are a number of modelling aspects.
I think we have time for another two. We are over time, but we can go another 3 minutes. Do you mind reading the question, or just saying what the question is and then answering?
Yeah, sure. So, The one that Melanie asked, did I not
Oh, no,
say the
well,
question?
no.
Other ones, yeah. Hong Kong definitely needs to be treated carefully. You et al. Report that walking is lower in the densest Hong Kong areas, and car use greater. Thanks, Jago. That's great to know. And so when we're writing up our papers, we do have our collaborators who will comment on the findings. And part of the result is this was a proof of concept project. Could we do these basic analyses that we have been doing in our local areas for other cities? And then there's the other question, well, are they appropriate and what are the limitations? And that's certainly an aspect of this study. It was seeing to what degree this works. And Esther Seren, and she has an affiliation with Hong Kong University. So herself and another collaborator from over there will be commenting on Hong Kong. But thank you for sharing the paper. That's excellent. Informal transport. Now that's a really good point. So the estimates for transport access were actually kind of poorer in, well, a few cities, but in particular, Mexico City, Chennai, and Bangkok. Now, partly this is to do with limitations in the public transport data, but it also relates to the informal transport milieu, which we didn't. That is absolutely plays a role, and we have not measured. So there's a strong network of regular and reliable collective transportation in Mexico City, and similarly, I understand in Bangkok and Chennai there are other modes of private transportation which fills a need, which we haven't measured. It's really important, and we're certainly aware of those aspects, but it's really important to bring up those limitations. And trying to do a speedy presentation, I probably have glossed over a whole load of things. I certainly have. But I tried to kind of consume them with that in that idea of we did consult with local experts, and that's an ongoing part of the contextualization. Notwithstanding U et al. Relative population densities in Hong Kong, they're still very high relative to Australian, US, Canadian cities, so overall relativity is likely valid. Thanks, Jago. I haven't been to Hong Kong for some time, but I'm really loving the city when I did go. Hopefully one day get to go again. I think that's all the questions that I can see.
Okay, well, that's great. Thank you so much, Carl, and thank you to all of you for attending. And we look forward to seeing you in 2 weeks for the next CURE seminar, and next week now for the CURE catch-up. So over to you, Jago or Melanie.